Germany's coronavirus infection rate has risen to its highest level since the start of the pandemic. Public health figures released Tuesday showed there were just over 213 new cases per 100,000 residents in the past week. That's higher than the previous record last December. Hospitalizations are still far lower than a previous peak, at a bit below 4 per 100,000 residents, but doctors say some hospitals are filling up in badly affected areas. Now, was this fourth wave that's hitting Germany avoidable? It could have been. Here's a look at one country that some are calling a role model in pandemic management: Israel.
Standing in line for a booster shot, like here at this pop-up vaccination center in West Jerusalem. Since August, Israel has made the third vaccination of the BioNTech-Pfizer vaccine gradually available to people over the age of 12. It is really important to help keep everyone healthy. Also, I won't get infected and sick or infect others. And it is a decision by our country that all have to get vaccinated, so I'm getting it.
So in Israel, things are slowly beginning to open up again. There's definitely a mask mandate and people are still being careful.
Almost 4 million eligible people out of a population of 9 million have received their third shot by now. Just 2 months ago, new infections with the Delta variant surpassed 10,000 cases per day, with hospitals seeing many more severely ill patients. And studies suggested that immunity was waning after 6 months.
There is no question that the third vaccine, the booster, saved Israel. When we started analyzing the new infections and then the severe infections, based on when they were vaccinated, we came to understand that the most important issue in the balance is the waning of the vaccine, of the immunity, rather than the Delta.
Israel ramped up its booster campaign, and new infections and hospitalizations began to slow. In addition, the government also tightened its Green Pass system. The app that shows the vaccination status is needed to get into venues like this health club. Those eligible who didn't get their third shot had their pass cancelled.
Everybody these days have the Green Pass on his telephone, and we check it every day when they come in. It's a little bit, sometimes it's inconvenience, but people understand, and we really try to make a safe zone here, and people cooperate.
The system isn't perfect. Compliance by businesses and people can be patchy. With the effects of the booster kicking in, the country also opened up its airport for foreign visitors. Ben Gurion Airport, Israel's main gateway, had been largely closed to foreigners since March 2020. Strict rules include testing before and after arrival. But the entry point remains a concern for health officials.
We cannot celebrate that we are out of the pandemic. Now, between the waves, our big concern is how not to have the fifth wave, of not to have another variant coming to Israel.
Israel is now looking at vaccinating children under the age of 12 and is closely monitoring how long a third dose will offer protection.
And I'm joined now by Professor Dr. Günther Schönrich, the Deputy Director of the Institute of Virology at the Charité Hospital Berlin. Doctor, can you say that what's happening in Israel could serve as an example for other countries?
I think it's a very good example for other countries. As pointed out in your trailer, booster vaccinations are very important to make the immune system again fit for the virus, and that has to take place about 6 months after being fully vaccinated. And it's a very important tool to break the fourth wave. So it's especially important for those people that suffer from certain diseases or that are especially vulnerable to severe COVID-19. So it's very, very important.
And just to come back to Germany for a moment, we keep setting new records here for coronavirus cases. What worries you most at the moment?
My biggest concern is that there are still too many unvaccinated people in Germany. About 67% of the population is fully vaccinated, and that is really not enough. And in the month to come, we will see many of those that are not vaccinated in the clinic. They will be admitted to the clinic. They will even have to be treated on the ICUs. So we have somehow reach for these unvaccinated people and convince them that they have to be vaccinated, that vaccination means protection for themselves, but also protection for their fellow citizens. That's also a very important step, and without it, I guess we won't be able to break the fourth wave.
And government officials have been expressing their concerns that ICU units may be overwhelmed. What's the situation at your hospital right now?
Yeah, the hospitals are filling up slowly. More and more people are admitted to the hospitals, and the ICUs are also filling up, and we have to cancel treatment, possibly of patients that have other diseases. So the situation is worsening. So again, it's so important that people that have not been vaccinated are vaccinated, and somehow we have to manage this very, very sensitive issue.
Okay, Professor Dr. Günther Schönrich, Deputy Director of the Institute of Virology at the Charité Berlin. Thanks so much.
You're welcome.
Let's take a look now at some of the other developments in the pandemic. Authorities in Denmark are considering reinstating a digital corona pass for visits to indoor bars and restaurants as the country enters a third wave of the pandemic. Ukraine has reported a record number of coronavirus-related deaths over the past day, with 833 people dying of the disease. And coronavirus deaths have also hit a record high in Bulgaria. 334 people died there in a 24-hour period. Vaccination rates there are the lowest in the EU.